I'd like to welcome you to this informational webinar of the South Central Ohio Insurance Consortium regarding the health and wellness benefits available to consortium members and their eligible dependents. My name is Bob McCollins with Pulse Health Solutions, and I will be leading this webinar today where we will be introducing to you the telemedicine benefits offered through 1-800-MD. I would like to note that this is a general information webinar about the program and benefits offered to the South Central Ohio Insurance Consortium members and their eligible dependents. Your specific group benefits may be different from those discussed during this informational webinar. For your specific group benefits, contact your Human Resource Department or the representatives of Miller Lewis Benefits at 740-654-4055. Telemedicine benefits are now available to consortium members and their eligible dependents and are provided through 1-800-MD, one of the largest and oldest providers of telemedicine benefits in the United States. A few years ago, just the concept of talking to a physician over the phone or through the internet to receive medical information or instruction was certainly a strange occurrence. Today, with the advancement of technology and the convenience of providing telemedicine services to providers, a telemedicine benefit has become standard in employer benefit plans offered to their employees. And as such, the South Central Ohio Insurance Consortium members have added these benefits to the consortium health plans beginning this year. Why would someone access or want to utilize telemedicine services? Well, first and foremost, it's the convenient way to access quality care 24 hours a day, 7 days a week, 365 days a year. It's a convenience way to access and provide relief and peace of mind, as well as direction and services for a health condition that may be ailing you, that instead of going to the emergency room or urgent care, you would have access to, most especially after your primary care physician hours are closed. Speaking of primary care physician services, it's important to note that the telemedicine benefit and services are in no way a replacement for your personal relationship with your primary care physician. They are the quarterback of your health care, and you should always seek out their services and support, as well as coordinate any services through any physician outside of your primary care physician. But for the convenience factor of accessing and providing relief to you after hours where your primary care physician is not available, or even during the workday when it's not convenient for you to step away from work to deal with a health issue, that is the valued benefit of a telemedicine provider. Common conditions treated that people would seek care for are non-emergency conditions such as allergies, bronchitis, colds and flus, headaches and migraines, insect bites or rashes, poison ivy, sinus infections, general and common stomach ache and diarrhea, urinary tract infections, pink eye type of infections, and just general information in non-emergency services is why you would consider to use the benefit of telemedicine. Additionally, should your treatment result in your telemedicine provider feeling it would be best for you to have a prescription to help relieve the situation, conveniently, prescriptions can be e-prescribed to your pharmacy of choice. Again, for ease of convenience of you to access your health care and, more importantly, your health care resolution through the telemedicine benefit and coordinating an e-prescribed prescription to your member pharmacy of choice that you can pick up at your convenience. All of you should have received a membership information card that you can keep conveniently in your wallet or in your person. If you do not have your card, you may request an additional card by calling 1-800-530-8666, and your customer service representative from 1-800-MD can help order another card for you. Your card is not required to access care. However, conveniently, the information is placed on the ID card, which will allow you to access the 1-800-MD services. The 1-800-MD member portal is a wealth of knowledge and resources for you, in addition to being the entry point for requesting a consultation with your telemedicine provider. There are additional resources relative to a health resource library, which you can access maybe prior to being referred to your primary care physician by your telemedicine provider, or for additional follow-up instructions from your telemedicine provider and or your primary care physician. Additional wellness tools, a very valuable symptom checker, and a very important drug interaction checker is also provided as a resource to you on the 1-800-MD portal. How the 1-800-MD telemedicine program works, step by step in the first, and we'll review in a second, you must complete your personal health history. This is the same information that you would be asked if you went to see a physician for the first time, or for the first time in a long time that you've seen a physician. As you would go to the physician's office, they ask for you to complete your health history profile. The same must occur with 1-800-MD, so they can have your personal health history to properly treat you when you need their assistance. So the first step that you need to complete is your health history on your personal web portal through 1-800-MD. The next step, once you have done that, when it's time to access and resource the 1-800-MD telemedicine benefit, you will request a consultation. The physician will then reach out and contact you after your consultation has been set up and your health history has been completed. They will provide the appropriate diagnosis and, if necessary, prescribe the appropriate medication. And then, additionally, they will coordinate with information provided on your website and at your request with your primary care physician for a continuous care. And step 6 would be the payment, which we will cover towards the end of this webinar for those of you who have a copay through your preferred provider organization benefit plan or health savings account plan. Again, the first and most important thing for you to do is to go onto the 1-800-MD website and complete your personal health history. This is critically important for when the urgent time comes that you need to access your telemedicine benefit and talk with a physician. Your health history must be completed before they can provide any sort of medical services to you and appropriate care treatment path. You can do this by going online to 1-800-MD, or you can get a copy from your primary care physician of your personal health history and fax it to 1-800-MD, and they will upload it for you. There are several ways to begin a consultation with your telemedicine provider. The easiest is to go to the member portal of 1-800-MD and request your consultation. Your consultation can be done over the phone or through email or over your computer with a video consultation. All three are available to you. Admittedly, the most convenient and most highly utilized is the telephone consultation, where the physician, once you have completed your personal health history and requested that consult, will give you a call and provide support to you in your time of health need. It's important to note here, as we've highlighted in the red, and I mentioned previously about the cost of the 1-800-MD benefit. If you are covered under a consortium PPO health plan. Your copay and cost to access the 1-800-MD benefit is the same as your primary care physician office visit copay. If you are covered under a consortium health savings account program, your copay is $25. Again, you will want to consult with your human resource representative or reach out to the representatives of Miller Lewis Benefits if you have questions regarding your appropriate copay for your telemedicine benefit. To request a consultation, again, you will go online to 1-800-MD and request a consultation, provide your callback number and the state that you are in at that time. It's very important to note that when you request your consultation to put the state that you are currently in so that you can receive the appropriate care from a licensed physician in that state. So if you are on vacation in South Carolina, you will select South Carolina, and you will talk to a physician who is licensed to practice medicine in the state of South Carolina. Or if you are in Florida at Disney World and have need and reason to access the telemedicine benefit, you will talk to a physician who is licensed to provide care in Florida. And certainly, if you're in your home state of Ohio, you would input that, and likewise talk to a physician who is licensed to practice medicine within the state of Ohio. It is highly encouraged that if it is a medical emergency, that you would immediately stop and dial 911, as well as if the call from your telemedicine provider at any point in time would indicate that you have an emergent need, they will immediately direct you to contact 911 and seek appropriate care. You will also complete the HIPAA privacy policy and make note that you understand and agree to the terms. And here's where you'll input your credit card payment information to take care of your copay. Again, if you're under a preferred provider organization or PPO plan through the consortium, that copay will be the same as your primary care physician copay. If you are covered under a health savings account program, your copay is a flat $25. Again, familiarize yourself with the 1-800-MD telemedicine benefit. It is a very convenient and quality way for you to access care at an appropriate time when you need it. Again, common conditions, allergies, bronchitis, cold and flu, insect bites, poison ivy rash, pink eye, stomach ache, very common non-emergent conditions are why you would want to access your telemedicine benefit from 1-800-MD. Thank you again for joining this webinar, and we hope that the information has been helpful. And again, if you would please note that this is a general information webinar about the program and benefits offered to the South Central Ohio Insurance Consortium members and their eligible dependents. And your specific group benefits may be different from those discussed during this informational webinar, and you are encouraged to contact your Human Resource Department for your specific group benefits or the representatives at Miller Lewis Benefits at 740-654-4055. Thank you for listening, and remember, the first health is wealth.